So if you're ever curious about whether it's time to implement medication management for anxiety and stress, this is again a topic that you can talk with a gastroenterologist about. We're now using neuromodulators to help with visceral hypersensitivity that again can affect functional bowel overlap, but can also be helpful for pain management in patients with IBD. And the wonderful thing about neuromodulators, if you are experiencing GI symptoms, but also experiencing higher levels of anxiety and depression, is that we can kind of kill two birds with one stone. So they can be effective at a therapeutic level for anxiety and depression, and they can also target symptoms in the digestive tract. And also, if you're not necessarily experiencing a clinical level of anxiety and depression, those neuromodulators can be helpful at a very low dose to help with both GI symptoms and mild levels of stress as well. And certain medications that you may think about with your gastroenterologist to talk with them can include tricyclic antidepressants, SSRIs, and SNRIs. And each class has a very specific target. So using neuromodulators, which is also another term for antidepressants, tricyclic antidepressants, which very commonly may include Elavil or Pamelar, they're used traditionally for patients that are having higher levels of diarrhea. And so you want to be very careful that because it has a side effect profile of constipation. So if you have a side effect of constipation and you're experiencing high levels of diarrhea, it may actually help to decrease the level of diarrhea that you're having. With an SSRI, it has a side effect profile that can include diarrhea. And so if you're a patient that's having constipation, that would probably be a better class of medication for you to experience and try. And then if you're really looking for pain modulation, SNRIs such as Cymbalta or Effexor can be very effective. But again, you always want to talk about all of your symptoms and why you're wanting to use this medication with a gastroenterologist. And if you are having more clinically significant levels of depression or anxiety, I certainly would encourage consultation with a psychiatrist who has a bigger bag of tricks and can really hone in on a treatment plan for medication management for you.